My name is Rebecca Mogidam, and my presentation is about cystic fibrosis. Cystic fibrosis is a genetic inherited disorder, meaning a child must receive one replicated copy of cystic fibrosis from each parent. Due to the persistent buildup of mucus, it can often block off airway passages, foremost resulting in respiratory and digestive problems, affecting special cells that create sweat, mucus, and digestive enzymes. Normally, these cells discharge lubrication to organs and tissue, inhibiting them from dryness or infection. People with cystic fibrosis don't have the ability to lubricate, which causes clogging of pathways in the body, resulting in infections, respiratory failures, and malnutrition. Cystic fibrosis emerges as a result of certain gene mutations or changes in the gene, specifically found on chromosome number 7. One out of the 23 chromosomes that are accounted for cystic fibrosis is inherited by their parents. Mutations in the gene that create a protein called cystic fibrosis transmembrane conductance regulator, commonly abbreviated as CFTCR. A person with cystic fibrosis builds abnormal proteins of CFTCR or does not have it at all, causing the thick mucus as mentioned previously. Normal lungs, breathing tubes, are leading to air sacs called alveoli that are lined with cells that make mucus, normally forming mucus that is thin that coats the surface of airways. These airways are invasive with constant dust particles and germs that are trapped in mucus. Tiny hair-like particles called cilia filter the breathing tube, sweeping any harmful particles upward to be coughed out. Because someone with cystic fibrosis does not have this same ability, the immune system releases white blood cells to the lungs to destroy infection from trapped particles. After white blood cells do their job, they add to the thickness of mucus. Symptoms can vary from person to person depending on the severity of condition a person has, affecting both symptoms of digestive and respiratory. Symptoms can appear not just at infancy but begin after puberty or later. As time goes on, symptoms progressively increase. One of the common known signs of cystic fibrosis is the strong salty taste of the skin. The salt is the control regulator by the protein found on the gene, as mentioned previously, known as the CFTRC protein. And this protein controls the movement of water and salt in and out of the cells. Symptoms may affect vital organs. Because the airways that carry air in and out of the lungs are known to be built up with mucus, it can often lead to symptoms such as the following: wheezing, shortness of breath, recurrent lung infections, stuffy nose, and stuffy sinuses. However, the abnormal mucus can also close off channels that carry enzymes that speed up chemical reactions produced by the pancreas to the small intestine. Without these enzymes, nutrients from food can suffer for proper absorption, leading to symptoms such as the following: constipation, nausea, loss of appetite, poor weight gain. This picture draws an illustration from everything mentioned before that are affected in the body, such as the sinuses, the lungs, the skin, the liver, the pancreas, the intestines, and the reproductive organs of both male and female, which are both affected in the same possible. Cystic fibrosis has no cure in presence, it has alternative treatments to reduce the irritability for more relief. This includes medications such as antibiotics to get rid of infections from reforming, mucus-thinning medications, or even anti-inflammatory drugs such as ibuprofen to reduce pain. Another option is chest physical therapy, which loosens up mucus in the lungs and is performed 1 to 4 times a day. Another option is home care. People with cystic fibrosis need 50% more calories a day, and they require more water and more exercise to loosen up the mucus. One of the many diagnostic tests are immunoreactive transigenogens, checking abnormal levels of a protein called IRT. Iron regulated transporter, a very common diagnostic test, is the sweat chloride. Cystic fibrosis is common among both males and females. Among the highest mortality is Caucasians. People with one copy of cystic fibrosis do not have cystic fibrosis, but are carriers, meaning they show no signs of cystic fibrosis, but have the gene to pass to the child. However, each time the two individuals that have cystic fibrosis meet. This doubles in probability. 25% chance that the individual will have cystic fibrosis, 50% chance that the child will be a carrier but not have cystic fibrosis, and a 25% chance that the child will be a carrier but not have cystic fibrosis.